Abdominal adhesions pain relief. A bowel obstruction is a blockage in the small or the large intestine. It is a potentially dangerous condition and has several causes. Someone with a full obstruction will find passing a stool or gas difficult, if not impossible. A partial obstruction can cause diarrhea. Obstructions cause a buildup of food, gastric acids, gas, and fluids. As these continue to build up, pressure grows. This can result in a rupture, or split. Whatever was behind the blockage can enter the abdominal cavity and spread bacteria. This can be fatal. In this article, we examine the symptoms and causes of a bowel obstruction. We also take a look at how doctors can treat this condition and what people can do to prevent it from occurring. Bowel obstructions can be painful and distressing. Symptoms include vomiting, diarrhea, bloating, constipation, cramping, decreased appetite, inability to pass stools or gas, nausea, severe pain, swollen belly, vomiting, and diarrhea are early signs of bowel obstruction. Recognizing these symptoms means that a person can seek treatment before the condition progresses. If a fever develops after some of these symptoms, speak to a doctor. It can be a sign of a split in the bowel. Causes. There are many possible causes of bowel obstruction. The different causes are either mechanical or non-mechanical. Mechanical obstructions are physical barriers that prevent or restrict the flow of matter through the bowels. These include adhesions, or tissue that can develop after abdominal or pelvic surgery, diverticulitis, a foreign object, if swallowed, gallstones, though this is a rarer cause of obstruction, hernias, impacted stools, infection, inflammatory bowel diseases, IBDs, intussusception, which is when a segment of the bowel pushes into the next segment, making it collapse, meconium plug, which is the first stool that newborns pass, tumors, a twisted bowel. Some refer to non-mechanical obstructions as ileus, or paralytic ileus. These occur when something disrupts the working of the entire digestive system. The large and small bowels move in coordinated contractions. If something interrupts this process, a non-mechanical obstruction can occur. If a doctor is able to detect and treat the cause, the bowel obstruction is usually a short-term issue. Some long-term, or chronic, medical conditions may cause a non-mechanical obstruction, however. Causes of non-mechanical bowel obstructions include abdominal or pelvic surgery, diabetes, electrolyte imbalances, hypothyroidism, Hirschsprung's disease, a condition wherein nerve cells are missing from the end of the bowel, infections, some nerve and muscle disorders, such as Parkinson's disease, opioid medication, risk factors. Some conditions and events increase the risk of a bowel obstruction occurring. If a person's intestines have not developed properly, they will be more prone to blockages. Other risk factors for developing a bowel obstruction include cancer, especially in the abdomen, Crohn's disease or other IBDs, which can thicken the walls of the intestines, previous abdominal or pelvic surgery, which may increase the risk of adhesions, radiation therapy. When to see a doctor. If severe abdominal pain develops, a person should contact their doctor immediately. Bowel obstruction can have serious consequences. A person should seek medical advice if any of the symptoms listed above occur. It is especially important to see a doctor if any of these symptoms occur after surgery. Diagnosis tends to begin with a physical examination. An obstruction can cause a hard lump in the abdomen, which a doctor may be able to feel. The doctor will also ask questions and look at a person's medical history. A doctor can use a stethoscope to check a person's bowel activity. A lack of regular bowel sounds, or the sounds being unusually quiet, can suggest a bowel obstruction. Depending on individual cases, a doctor may recommend further tests. These can include blood tests to check levels of electrolytes, liver and kidney function, and blood counts, endoscopy, in which a doctor uses a special camera to look inside the gut, CT scan, X-rays. Doctors may administer a substance called contrast via an enema. Contrast allows doctors to view the bowels more clearly when carrying out imaging tests. Treatment for bowel obstruction depends on the cause and how severe the blockage is. A total mechanical obstruction usually requires surgery. Most cases of bowel obstruction need some form of medical intervention. Treatment options for bowel obstruction can include medication. Opioids can lead to constipation. If this occurs, laxatives and stool softeners will help. Observation. Ileus may need monitoring for a few days and often resolves with time. During this time, people should limit food and drink to stop further buildup. Doctors can provide fluid intravenously to keep people hydrated. Nasogastric tube. This is a narrow tube that goes up the nose and into the stomach. It removes fluid and gas trapped in the stomach, relieving pressure. This eases pain and vomiting. Surgery. Surgeons can remove blocked or damaged sections of the bowel. In cases of IBDs, a strictureplasty may be necessary. Here, a surgeon will widen a narrowed section of bowel by cutting and sewing. Therapeutic enema. A nurse or doctor will push a medication or tap water into the bowel to try to relieve stool impaction, which can happen in severe constipation. Medication may help ease discomfort due to a bowel obstruction. This can include antinausea medicines to prevent vomiting, pain relief medication, antibiotics to fight bacterial infection.